Hello, everybody. Good afternoon. I want to let you know that Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa from PAR5 Physical Therapy, and I partnered with them to bring you an easy and educational workday session. So today's session is about building a resilient body. We're continuing the series and going into the lower back. So I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I've been a PT for over 20 years. And today I want to give you some good information about how to address the most common issue that 80% of Americans will experience in their life, and that's lower back pain. So let me get this out of the way and we'll get started. If you have any questions, feel free to use the chat window or raise your hand or something like that, or unmute yourself. It's a small room, it's intimate. Give me some questions if you have them. But let's get you started here. Important note always, if you've been to my sessions, I have to give this disclaimer because I'm a medical professional, that the stuff that we're going to go over today is general information and is not intended to replace consultation with a medical professional. So keep that in mind. And also, this is another thing that I always put up if you've been to my other sessions, that the body functions on this alternating pattern of stability and mobility. If that pattern is disrupted, pain or injury is a result. So here's a video. You've probably seen this before. Basically, this alternating pattern of the stability and mobility, particularly if we pay attention to the lower back is supposed to be a stable segment. If the lower back is not stable, then we wind up to have pain, but it's generally not the problem starting from the lower back. It's usually what I find with a lot of clients that I've seen is that the hips can get immobile, they become tight, they lose the function of the mobility, and then the back gets the brunt of the forces, or the mid back, which is the thoracic spine, that T-spine, that can become tight. And then your lower back is also getting the brunt from that. So as we go through the exercises and stretches today, we want to keep these things in mind. We don't want to push through pain. If something hurts, do not try and push through it. There is a difference between discomfort, like a stretch discomfort, and pain. You could breathe and exhale twice as long as your inhale to help relax your muscles as you go into these stretches. And you want to hold the stretch for at least 30 seconds if we're trying to stretch a piece of soft tissue like a muscle or a tendon, to maintain that length and not have it snap back into a shortened position if you hold it for a shorter period of time. The other thing is that if we're going to go and do a joint mobilization where we're trying to mobilize a joint and make that more flexible, we're not going to hold those positions. We're going to go in and out of a restricted range of motion and do it for 2 minutes. All right. So a lot of the things that I like to do is I do a pre-test, some type of treatment or exercise, and then a post-test. The pre-test that we're going to go through here may be familiar if you've been to my previous last week's session on the hip. We're looking at multi-segment flexion and extension. Flexion is basically bending forward. Extension is just basically going backwards. The hip flexor flexibility test, we've done that because it is so important. The hips and the pelvis are pretty much the center of our body, really close to the spine and the core, the lower back. So for 3 weeks now, I think we've gone over this hip flexor test. So you should know by now if you have a tight hip flexor and exactly what part of your hip, your quadricep, your tensor fascia lata, or the psoas muscle is restricting your hip mobility. And then we're going to go into this test called the straight leg raise, SLR, to test your hamstring flexibility. All right, so this is the multi-segment flexion and multi-segment extension. You're just going to put your feet together, your knees are going to be straight, and then you're going to bend forward. We should look for a uniform bending of the spine and the ability to touch your toes. Now, a lot of people that come in to see me cannot touch their toes. We got to find out why that's true. Is it truly because of hamstring tightness or length, which is two different things, or low back immobility, the inability to flex through the low back? So I've seen it from all different angles. It can be low back mobility, it can be hamstring length, or tightness. Those are two different things. And then also, if we look at the other picture there, extension, lumbar or multi-segment extension going backwards, what we're looking for is that the front part of the hips past the toe line and the bottom part of your shoulder blades past the heel line. And then that should be pain-free as well. Now, if you're having pain in any of those directions, then we're going to tease that out. Our next test is going to be our hip flexor test. This is also known as a Thomas test to test out your hip flexor. We went over this last week. We're just going to review it today. You're just going to be lying at the edge of a couch, table, or something like that. And then you're going to bring one knee into your chest, and then you lie back, keeping that knee into your chest. So if the leg that you're holding, I'm going to grab the table here so you can see me. This leg right here has to be tight to the chest as you lie back, and we're looking at this other leg. Does that go totally down without this moving? If this goes down and this goes forward, that's a fail, okay? And then we look at the angle. If we look at that bottom right, does the hip, knee, and shoulder stay in line? So those are some things that could tell you what is exactly going on in terms of what's tight. The letter A, picture A is going to be our passing test. Letter B shows up. If you're letter B, then you have a tight quad muscle, which is the muscle in front part of your thigh. But if you're more like picture C, then that is due to a tight hip flexor, which is a deep muscle starting from your lower back that runs into the front part of your thigh. And then if you're looking like letter D, that is tightness on the tensor fascia lata muscle, which is part of the IT band. So this is the straight leg raise test. You're basically going to be lying down. Your hands are going to be down by your side. And then you just raise the leg straight. You cannot bend the knee either side as you bring your foot up. So passing would be 90 degrees of knee of hip flexion, right? Should be able to kind of get your leg totally straight, lying on your back. I'm going to show you over here. Well, it's going to be blocked by the picture, but basically this leg stays down, this leg stays up, and we're looking for 90 degrees. All right, so let's go into the common stretches to address any of the issues. The one big thing that I always tell people that have back pain is that if you're dealing with a chronic issue for months or years, typically we'll go through an evaluation that will reveal your directional preference, it's called. That means that bending forward or going backwards can make things worse, and usually the opposite direction will make things better. And then you pick one, you keep doing it. So we have examples of the top picture here being the extension directional preference. If that feels good, we keep doing it. If it hurts, then we go into the flexion-based directional preference. This is the bottom picture here, and that's lying on your back, bringing your knees into your chest. Or you could also do it on hands and knees and kind of going back into a child's pose position, similar to what you would find in yoga. So if going backwards hurts, then again, we want to try and facilitate going forward, bending forward to relieve the tissue pain and reduce the restrictions. If you have pain going backwards, don't go backwards, go forward. So directional preference, we pick one direction, and then we keep doing it multiple times a day and multiple positions. You could do it in standing, lying, sitting. It's sort of like this movement or stretch. You have to think about it like a medication. If you take 5 milligrams of something versus 500 milligrams of something, you'll get different effects. Maybe 10 repetitions of a movement might not be enough. You might have to do 20 or 30 every hour. And then that should help to reduce your pain or control your symptoms. All right, so this is a couple pictures of the muscles in the back. The quadratus lumborum TPM is the quadratus lumborum trigger point massage or trigger point release. The hip flexor stretch we went over last week, and also the cat camel, we'll go over that today. So the quadratus lumborum is this thick little piece of tissue that is in the lower back. Show you my side right here. It's right above the hip, pelvic bone, and it runs up to your lower ribs. So that area right there is where that muscle quadratus lumborum lives, and we're going to kind of work on that muscle today. This is the front view of the lower back. The trunk has all these abdominal muscles there. The one that we're most concerned with, and if you have chronic lower back pain, you probably have an inability to contract or control this muscle, is the transverse abdominis. The transverse abdominis muscle runs around the body like a girdle. It starts on your lower back, it wraps around like a girdle and creates compression and stability in your lower back. So it's like if you've seen people that wear back braces or a weight belt, it's basically your own body's weight belt or back brace. If you cannot control this muscle, then that may lead to lumbar dysfunction and pain. All right, so as it contracts, it just creates tension. It is different than your diaphragm, so that if you feel like, oh, I'm gonna suck in my belly and you cannot breathe, that means that you've substituted activation of your diaphragm for your transverse abdominis. And we have to kind of dissociate those two. All right, so activating the transverse abdominis. We're gonna go into this today, and we're gonna try in different positions here: quadruped, plank, and sitting and standing. So I'm gonna open up the picture here, come back into my one shot. All right, so we're on the table, and the transverse abdominis, right? You're gonna be lying on your back. Your knees are gonna be bent, okay? And then you're gonna find your pelvic bone. Your pelvic bone is pretty easy to find. It's pretty sharp and pointy right in front of your hip there. And you're gonna find that and then take your fingers and then just kind of dive in about an inch inward from that bony landmark. That's the area that you can, that's the only area that you can palpate the transverse abdominis because of all the other abdominal muscles and tissue that we have in the abdomen. So what you're gonna do, the cue that I always give people is pull your belly button into your spine and you see what happens. Do we feel contraction or tension underneath where the fingers are, or are you holding your breath? So that's how we can tell whether or not people are using their diaphragm to create that tension or using their transverse abdominis. Another cue I give people is to pull your belly button down into your tailbone or contract your pelvic floor like you're doing a Kegel. All right. Once we have that command, then we go into a different position where we could see if we can get into control of the control of that transverse abdominis from the quadruped position. This is an all fours position here. And we have the cat camel stretch that we mentioned earlier. It's basically kind of pushing your back and rounding into flexion and then sagging the back and pelvis to the extension. So cat camel is a very supported and easy stretch to do, especially if you have acute back pain. But being able to control the transverse abdominis in this position would be paramount before we start to move into upright positions. So we're here. If we can control the transverse abdominis on your back, then we're going to try and control it here, because now we're pulling up against gravity, but I should be able to breathe and not flex my spine, all right? Because that muscle, once we find neutral, like if I'm going to extend here all the way down and all the way up, and then do that a couple times and feel, all right, where's my spine? Where's the middle? Once I find my mid-range, then I'm going to contract my transverse abdominis. If I do that, my spine should not move, right? It's creating tension, but no movement, because again, the fibers of that muscle just run around like a girdle and they just create the tension. And then you can go into a plank position. If you want to be, more advanced, a lot of people do it from the elbows or the hands, and then just popping the feet up and creating tension through the whole body. That should be felt in the abdominal area, and you should be able to breathe in that position as well. And if you're sitting or standing, actually sitting, right? So if you're at work and you're at a desk and you're sitting, you could still do that cat camel, but we call it a slouch and overcorrect. It's basically the same movement that we did on the hands and knees, just kind of tilting backwards, sagging, rounding the back, and extending the back, sitting up as tall as possible. The movement should be originating from the hip here, from the pelvis. You can see my pelvis tilting backwards as I sag and tilting forwards as I come up. And then again, I could go back and forth, find my range of motion, and then find my middle, my mid-range, and then see if I can contract that transverse abdominis in this position, okay? The transverse abdominis is a different muscle than any other muscle in the body. It's sort of like if other muscles were like a light switch where you turn them on and off, they contract and they relax. the transverse abdominis is like a muscle, like a light on a dimmer switch, sorry. So it's always on when you're upright or even sitting and you're unsupported. If your back is not supported by anything, it should always be on. It turns up to 100% when you're trying to lift or push something, but generally that should be on at all times.